Okay, so the blood vessels in the pig. So first, when you opened the pig, the general orientation. So here we have the heart in the pig, liver, intestines, urinary bladder. If we move the intestines here, we're gonna have kidneys. There's one kidney here, and there's another kidney right there. And then over here we have a diaphragm. So right now the diaphragm has been cut to allow us to see some of the blood vessels, but normally it would be right here. Then here on top of the heart you have part of the thymus right here. Now focusing on the blood vessels here. So here we have the heart, and from the heart you have the aortic arch that goes right here. And then you also, if you reflect the heart a little bit, you will see there is the left subclavian artery that goes right off the aortic arch, and you also see the brachiocephalic trunk that is here with a black pen that goes also off the aortic arch. And then here off the brachiocephalic trunk you have the right subclavian artery that goes right here. And then that so we can't actually see the more arteries on the right side, so we'll go onto the left side. And so on the left side, like I said, there's a left subclavian artery that is there, and then over here there is going to be the axillary artery right here. Then that continues to be the brachial artery here, and then the brachial artery, if I can focus here, the brachial artery eventually splits into the ulnar and radial artery. Now for the veins, so if we look at the heart, right here the major vein is of course the superior vena cava. And if we try to move the heart down there, you can see between the heart and diaphragm, you can see the inferior vena cava with the white pen. And so then over here, again, superior vena cava, and that goes to the and then we have the brachiocephalic vein right here. So that's a major big vein. So there's this is the right brachiocephalic vein that's labeled, but then there's also left brachiocephalic vein here. And then we have the internal and external jugular. So internal jugular here, and external jugular is going to be here with the black pin right here. Those go to the head, and then going here into the arm. Okay, so here with the green you have right subclavian vein, and then that continues into the right axillary vein. That continues into the right brachial vein, which splits into the right radial vein and right ulnar vein right here. Now in the abdominal cavity, as you can see, I moved away or reflected the intestines and the urinary bladder here. And so now we can see this right kidney, and in the kidney, so going in and out of the kidney, there's renal artery and renal vein. And then here we have the inferior vena cava. So this is the abdominal portion of the inferior vena cava. And then next to it, or parallel to it, there is the descending or abdominal aorta. Then, let's see, for the arteries, we have the right external iliac artery that, so we'll have to reflect. This is the uterus here. And then we have this right here for our, let's see if I can focus this better. Okay, so this is our right external iliac artery that then continues over here. So you can see there's a split there. And then that is the right femoral artery. And then over here, this one, this right here is the right deep femoral artery. And there are veins that are parallel to this. So already mentioned inferior vena cava. And then if we look here, there's a split. And so this blue pin is the right common iliac, and then that continues here to this black pin, which is the right external iliac, and then that continues to the right femoral vein right here. So veins are deeper to arteries in this region, so they're a little bit more difficult to see. And of course, there are most arteries and veins are symmetric, and so we're just showing here one side. And then, since this is a fetal pig, you're also going to see the umbilical arteries and umbilical veins, and so actually, right here at the end of the abdominal or descending aorta, you can see these large vessels, and so these will be the umbilical arteries. You can actually see that they continue on here on both sides of the. Okay, so you can see that the umbilical arteries again split off the abdominal aorta right here, and then they continue going on around the urinary bladder. So there's one here, there's one here, and then they do connect right here to the umbilicus right here, and then over here, this vessel here is the umbilical vein that goes there through the diaphragm and actually joins the vena cava eventually. So yeah, so there you have it for the pig.